Excellent question. Thank you. See, tuberculosis is caused by what you can cause as bacteria, but technically it is called Mycobacterium tuberculosis.
Right.
It was detected as early as 1888 by
right.
Dr. Robert Koch. But first antitubercular drug came in 40s, 1940s. So 60 years we didn't have. Now, it enters system through lungs.
Right.
As I said, it is transmitted by droplet. You know, when a person has tuberculosis of the lung, he talks or speaks or sneezes or coughs or even just breathes. He is liable to excrete millions of bacteria with each breath. Now, primarily it affects lung, it enters through lung, but it can affect any organ of the body.
Any organ of the body.
Lymph glands being second, it can affect brain, it can affect intestine, it can affect even covering of the heart, it can affect bones.
So almost the whole body.
Almost the whole body.
Right.
So, therefore, the tuberculosis for the purpose of description is divided into two. Lung diseases, what is called as pulmonary tuberculosis, and other than lung is extrapulmonary tuberculosis. Now, lung disease is concern of everybody because a person with lung disease transmits disease. Extrapulmonary disease is a concern of every physician because it is slightly difficult to diagnose. Suppose it affects covering of the heart or it affects brain, or so the diagnosis becomes difficult, but the presentation is somewhat common. That means the patient has fever, patient has weakness, patient is low on energy, patient loses weight, patient loses appetite, then he has symptoms pertaining to the organ affected. If he has brain, he will have headache, he will have maybe fits. If it is in bone, he will have bone pain. If it is intestine, he may have diarrhea. And in the lung, of course, the cough.
So, which means that it can be pretty challenging for the other doctors as well to come to a conclusion that okay, this person could be suffering of tuberculosis.
The diagnosis can be very easy in pulmonary tuberculosis, but it could be exceedingly difficult in some forms of extrapulmonary tuberculosis.
Right.
It is a contagious disease. It spreads by droplet infection. Somebody who has got lung tuberculosis, he may have fever, he may have cough. He does not know that he has tuberculosis, or maybe he knows, but he moves around. He goes to the school, he goes to the office, he goes to the elevators, he goes in the buses, keeps on transmitting these bacilli. What we call as bacteria, we call it bacilli. Now, the biggest question as I am coming to the point is that if you are able to catch this person early and treat it, within few weeks time he becomes non-contagious.
Correct.
So, this is the bottom line. If we are able to detect all the cases of tuberculosis early and treat them, if not isolate them, these days we do not need to isolate them. If we treat them effectively with the good compliance with effective medications which are widely available and available for free. But unfortunately that is not the case. Patient with tuberculosis keeps on moving for years together, suffering from cough and fever, sometimes they get better and then keep on transmitting. So, this is a big problem, and of course, the government and all the health society and the politician and everybody has a duty towards society to provide those services, so that we can control tuberculosis.
Absolutely. We can start to talk a little bit about the kind of treatment. DOTS is something that many people are really aware of. But what is this treatment? What are the kind of medicines that are given? And also, are there any side effects to those medicines? Many questions, I think.
No, this is a very important thing. We all do it every day.
Correct.
Treatment for tuberculosis, as I said, for 60 years physicians were diagnosing as no treatment. Then 1940s streptomycin came. Now we have treatment what we call as short course. Short course is 6 months, it is not 6 days. Because previously it was 18 months. Now it is called short course. So, if a person takes treatment for 6 months with a good compliance, that means regularly, then he gets cured of the disease, and I need not recite the names of the drugs. There are mainly category 1, we give 4 drugs and they are given in a fixed dose combination, But you have asked a very excellent question with a lot of implications, because there are several side effects.
Correct.
These are very big size tablets, the person takes. Initially they will have what we call in Hindi पेट में गर्मी हो जाना. Feel that they feel eat in the stomach, they may have vomiting, they may have nausea, the urine turns brick red. They get scared. We have to warn them of that. Most importantly, there is something called hepatitis, that means like jaundice. Something like 2 to 5% of the patients, or 2 to 10% of patients will develop some form of hepatitis. And this will come in the form of extreme distaste for food, nausea, vomiting, complete loss of appetite, and jaundice. This is not only leads to the discontinuation of therapy, this can be fatal also. Some small percentage would die. And this leads to non-compliance with the medication as far as the program is concerned, and this leads to further genesis of resistance also. That is a long-term implication. Besides this, there are other side effects like involvement of nerves can be there, or some fever-like syndrome can be there, but these are the major side effects which I want to point out.
That's right. Those people who are suffering of, say, MDR or XDR, do their other body parts, are they at risk of anything else really developing? Like deafness is one. If I may be, I don't know if I'm right or not, but I guess I've heard that people also get deaf because of this. Is that true?
First, I think I'll spend a minute on why does MDR occur. I think we must tell everybody who is listening this program or watching this program, MDR is a man-made problem. When tuberculosis was there first detected, there was no MDR. MDR has occurred after the drugs have come in, and as Dr. Sareen has said, that people become resistant because the bacilli or bacteria has a survival instinct. If you treat them, if the enemy, if you don't hit him hard, he survives and he becomes stronger. So, what are the causes of genesis of MDR? The biggest cause is non-compliance. That patient has been given a drug regimen and he takes it for 3 weeks or 4 weeks, either as he has side effects or he becomes well, he thinks that he is good. Or he thinks that no, he goes to alternative medicine because he has side effect, he goes to alternative medicine. 2, that drugs are not given in proper regimen. There was a study in Bombay where there were 67 type of prescription they collected from the physicians. So, there is no uniformity in prescription. These drugs are available over the counter sometimes. People just buy it, and some practitioners who are not registered are giving drugs for 1 week, 2 weeks and stopping it. There also could be an issue of absorption of these drugs, which needs to be identified. Some person has a malabsorption problem, he has a diarrhea, meaning thereby if all the patients who have drug sensitive tuberculosis are treated properly with the good drugs, with the good dosages for a proper time, there is nothing called MDR TB should happen. In that context, there is one primary MDR, that is called acquired MDR. Now, come to think of it, if the person has developed MDR, he goes around transmitting. Now when he infects a person, there is no fault of his that he has got MDR, because the bacteria which he imbibed from another person were already resistant. Now, coming to your question that you asked, patients with MDR have pulmonary tuberculosis. They also have extrapulmonary tuberculosis, which can be in lymph node or intestine. As I said, pulmonary is easy to diagnose. Now, there is a risk of tuberculosis spreading to any part of the body. If even when you are treating a patient, if your drugs are not effective, one, that it can spread and involve the whole of a lung or other lung. It can also spread through blood or by contiguity. It can affect nearby organs, or it can go to brain state, it can go to liver, it can go to spleen, it can go. So, patients with MDR have a higher chances of having symptoms. But as Dr. Sareen has very nicely pointed out, after some time when they respond, their adverse effects make them so unwell that they sometimes don't continue. Now, one of the adverse effect of second line drugs which are due to the injections is hearing impairment. For that, it is extremely important when we give treatment by daily injections. At that time, we must get a hearing test, what is called audiometry, every month. We must do kidney functions every month. If we are not doing, we have no business in treating. Also warn them that please keep checking on your hearing when you are talking on phone. If you feel that you are not good, unless you tell them, they won't know. And they will land up, and this deafness or hearing impairment is largely irreversible, unfortunately.
Oh yes.
So therefore, and there are million adverse effects. So therefore, MDR has to be treated by a person who has experience in this.
True. Well, thank you very much for explaining this so beautifully. To tell us a little bit about XDR. What is it really?
Yeah, it's a very fancy name, extremely drug resistant tuberculosis. Today morning in the Times of India also there was the write up on that. We call MDR TB or MDR tuberculosis when there is resistant to two most potent drugs, namely rifampicin and INH. To circumvent that, you give second line drugs. I am making it as simple as and that invariably includes one injection and other drugs which are called quinolones. Simplifying it, when over and above MDR there is resistant to second line drug also, then it is called XDR tuberculosis. The implication is that it's more difficult to manage, the treatment is more difficult, and it's likely the outcome is also worse. So that's the definition of XDR, and it has been coined now a few years back, but it has been there all the time. It has been the term has been coined now, and it's really a fancy name, but it's a very bad diagnosis as far as the patient is concerned, because the treatment is really very difficult.
So finally, what would you like to tell the public, sir? Any message that you would want to leave behind?
No, whatever I'll say is going to be a repetition. The tuberculosis is an easily diagnosable and easily treatable disease, and compliance is the biggest issue. If you take complete treatment, you will be cured for life. However, if you don't take complete treatment, then the chances of MDR is there, and even with the whatever advancement we boast, MDR is a difficult problem to treat. It not only affects a person individual, it affects the society. So that must be kept in mind.
True. Well, on that note, I'd like to say thank you